Thanks, Robert.
More to come this morning. Prescription drug abuse is the fastest growing drug problem in the U.S.
Yeah, and coming up next, we'll talk to Dr. Gonzales more about the dangers of that trend after the break.
Prescription drugs have been in the news a lot this week. Earlier, of course, reports that Whitney Houston was using Xanax and that potentially that may have been one of the contributing factors in her death. Of course, that has not been ruled just yet, but Dr. Gonzales in with us this morning to talk a little bit about all these different drugs that are out there. Nowadays, I mean, back 50 years ago, these drugs didn't even exist, or they were not used nearly as much as they are today.
That's true. Good morning, Kyoshi.
Good morning.
Yeah, no, they're much more prevalent now, and we're giving out medication at a much higher rate than we used to, and sometimes it's indicated for things such as thought disorders, mood disorders, but I think we tend to probably over-medicate for issues such as anxiety disorders.
And why is that?
Well, I think there's a lot of issues involved. One of them, it's quicker, it's easier. A lot of it has to do with the insurance companies, what they value, big pharma, business, economics, what they disperse for medications, consults versus psychotherapy is much different. It's what's valued, and it's quicker and it's easier.
You were giving me an example. You say a lot of the psychiatrists in town don't even do the behavioral therapies anymore. They actually get paid better in order to do a consult to give somebody some medication.
Well, it doesn't make economic sense for them to do therapy when they can get reimbursed much more for doing med consults. When I first came to town, I did work as a registered psych assistant for 2 psychiatrists that both did therapy, and I think things kind of changed about 1994, 95 when managed care came in, and they started to change the standard of care themselves rather than what the data suggests. It's been more of a big business kind of thing.
And when you say obviously for schizophrenia, somebody who may harm themselves, where they need some kind of medication to get them on the level, but you say anxiety, it's overtreated. Why is it used so much in anxiety? And there's other things like what? Biofeedback training and things like that may be more effective?
Yeah, schizophrenia is essential. We don't want people to have episodes because it takes a toll on their brain, but with anxiety there's other methods that not only are proven to be just as useful but have longer term effects. Things such as helping to self-soothe. Learning to calm oneself down, cognitive restructuring, behavioral stuff, psychodynamic work, exposure therapy. When you want, really the key is dealing with the core issues. You can expose patients to these symptoms and have them work their way through it is really essential for treatment. And with medication, sometimes what you do is you're sort of masking the symptoms.
You're papering over the real issue. And when we're talking about Whitney Houston, I mean, this Xanax drug, what are the dangers of these drugs?
Well, when you talk about central nervous system suppressants and you talk about some of these benzos, they're in there, they have an effect on the central nervous system. They can cause the heart rate, the respiratory system, the blood pressure to go down. And when you mix that with alcohol, it can have what we call a synergistic effect, where the effect is greater than the sum of the 2 equal agents. It enhances the effect, and it can actually shut down the breathing for some people. So with Whitney Houston and people such as that, if they have a significant history of rehabilitation and substance abuse problems, you have to realize they're not a normie. They're not someone who can socially drink. So if you really care for someone like that,
you've got to watch.
You would know that, not be in denial. They've been in rehab. They're not a normal social drinker, and their brains are much more sensitive when it comes to rewards response.
It's an interesting case, and obviously we're going to have many conversations, I'm sure, about this as things go on. But Dr. Gonzales starting us off this morning. Thank you so much.
Always a pleasure, Kyoshi.
All right, let's send it back to you, Maddie.
All right, thank you. Organic food is off